Welcome, Tanesha.
Hi there. I was having technical difficulties as usual with Zoom. I'm not sure why, but I definitely apologize. I am here and thank you for your patience. I really, really am excited. I don't even think I can articulate it. I think I've told Carlin like 6 times, like, "Ah." And of course, to be, falling in here at 6:33. I'm so sorry, but thank you all for your patience. I really appreciate
Wonderful. I guess
it.
you ready to get started or you want to wait?
Yes. Oh, no, no. Good, good. Let's see. We have, yeah, yeah, for everyone who's already on, I won't keep them waiting a second longer.
Alrighty.
Yep.
All right, so we'll get started. So my name is Carlin Henderson, and that's Tanesha Nobles, and
Yay.
we're doing this is the webinar for Intro into Mental Health within the Black community. It's more so like a intimate conversation where we can learn and discuss more about mental health, stigmas, barriers, treatment, and how to find resources culturally relevant resources as it relates to the Black community. And we both found that this was like really important to bring forth and discuss with everything going on in the government and politics, and just everyday stresses of life, that there's a sense that we can build community and we can really learn from each other and learn more about how to take care of ourselves, to achieve mental wellness, and really prioritize our own self-care and well-being, which is something I think sometimes in our community we don't put enough emphasis on. And also, we just don't have the resources sometimes, or the knowledge, or the access to the care or the information. So, I mentioned it to Tanisha, and she was on
Ecstatic.
board immediately. So, I'm really
First of
grateful
all,
for
I love
her.
Carlin so much. We go way back to NYU days, just for you all who don't know the history. And she was one of the most amazing, and I say that word not to use it as the over exaggerated word amazing, but she just was so genuine and so smart and so personable and just welcoming. She was like one of my first friends. And so to have journeyed this far along and to see her grow and develop and become the person she is now is amazing. So this is so awesome. I jumped at the opportunity. Trust me. She's being modest. I was so happy to work with her.
So I'm very grateful for you as well, Tanisha. And we hope that this can be something that we continue to do, have webinars or events in person, online, um, about mental health and different topics. So as you are on this journey with us, if you have any comments or questions, please feel free to drop it in the chat and we will take a look at it. And also, I know there are some people that did send in questions, so we'll also talk about those or answer those questions at the end. If hopefully we'll have time, we should have time. And we'll also send a follow up with the resources and everything from tonight, in a follow up email as well. All right, computer. Bear with us.
Yep.
All right. So welcome again. This is the again webinar for the intro into mental health within the Black community. And what we're going to be discussing during this webinar is really the definitions, mental health, mental wellness versus mental illness and mental illness conditions, how stigma and trauma affects us, what are some barriers to our care, um, what are resources tailored specifically for Black people, treatment options, and then, like I said, again, we'll be talking and answering questions. So we are the hosts, Tanesha Nobles and myself, Carlin. So Tanesha, please.
Yep. So I'm from Mississippi, and then now I live in Atlanta. I stayed in New York for a couple of years. Met some wonderful people, including Carlin. I'm at NYU, journeyed on to accomplish my nurse practitioner degree with the specialty in psychiatry, and I'm very passionate and very forward about the need for more meaningful conversations surrounding psychiatry, mental health, and mental wellness. So that's what this is, the first of many, as Carlin mentioned. So, yep, I am definitely very Southern, well traveled, but definitely love to converse. I love to learn. And so, on any platform I'm a part of, I use that opportunity to learn from the audience as well. So, this is exactly what I enjoy doing.
And again, I'm Carlin Henderson. I am an adult gerontology acute care nurse practitioner, also a primary care nurse practitioner, and an advanced practice holistic nurse board certified practitioner as well as Reiki certified. And I started Around the Way Namaste as a holistic wellness business where I can provide services, information, resources to Black people in providing also integrative medicine with traditional and modern medicine combined. And just really hoping that we can setting out to achieve overall well-being for the Black community. Okay, so what is mental health? So, according to the World Health Organization, mental health is a state of well-being that allows people to deal with stresses of their life, recognize their own abilities, have the ability to live and work well, and being able to contribute to society. It is a component of behavioral health, including emotional, psychological, and social well-being. So again, mental health encompasses everything. Mental health versus mental health conditions or illnesses, as it's called sometimes as well. So mental health is something that we all have. If you think of it like physical health, we all have physical health. Some have better than others. Some people have physical illnesses. So think of mental health and in the same regard. Mental health is just your overall well-being, where our goal is to work towards mental wellness. It does take effort to achieve that as well as physical wellness. Mental health conditions or illnesses are diagnoses people receive from a healthcare professional. And these diagnoses can include like eating disorders, addictions, bipolar disorder, anxiety, depression. There's so many to name, PTSD. And again, mental health illness is not something everyone has, but mental health is. That's the distinguishment. Oh, 1 second.
I'll use this opportunity to say that with mental health, I think there's a lot of emphasis on mental health and the illnesses component, whereas I often like to reframe the conversation and the slide that I knew was coming and kind of direct it toward mental wellness, because just because there's mental illness doesn't mean that that's the only corner of the room that we have to focus on. We do have the other end of the spectrum called mental wellness. And when you understand what well is in the setting of illness, it's easier to identify if something is concerning. And I won't say wrong, because a lot of times there's no control over mental illness. So I'll just use the terms present and absent. And so mental wellness is literally the absence of mental illness, whereas mental wellness is an entire component that encompasses your self-care and personal agency to cope with everyday challenges, because we all have them, and to be able to accomplish that without a lack of self-care, social relationships, education, and work. And then whenever those components of our lives are negatively impacted, then we can move the spectrum toward, is this situational, circumstantial, which is sort of in the middle, because then you can always reverse it once you remove those circumstances that are triggering or causative. Or are we going to move it toward mental illness, meaning no one caused this to happen? This person is hearing voices and feeling bugs crawling on them, or they're just feeling depressed and they have everything that anyone could imagine. And so there's no causative agent that is voluntary in that setting. So then we start to look for causes such as mental illness. But this slide, if once we're finished, we'll share it with you. So I won't. Yes, I love I love the comparative to physical health too, Patricia. And I'm so happy that Carlin introduced it because a lot of times we can describe to you what your blood pressure looks like. We know immediately when you get a headache, when you start sweating, and you feel like an elephant is sitting on your chest. Well, it's easy for us to send you to the emergency room because we know that something may be happening in the setting of a pulmonary embolus, or it could be myocardial infarction. Either way, we have signs and symptoms. Whereas as Black people, we're very often encouraged and learned behavior taught to us to just continue on. We can pray, and I'm a Bible raised person from Mississippi, so I don't devalue that. I what I do say is that sometimes when you've done all you know to do that is right, and you need a little assistance, it's not weak and it's not unwarranted to ask for help. And in the setting of that, we as providers and clinicians, we're here to help. We're not here to reduce the power of prayer because I know the power of prayer. We're here to then say, here's something that God has offered us a gift, and we're able to deliver these other options for you to get you through to the other side. And here's what you can look like on the other side. So mental wellness is your everybody has the same desire. We all want safety, we all want security, we all want peace, joy, happiness, love, and purpose. And so mental wellness encompasses all of that. And basically you can be mentally well and still have components of mental illness. So meaning you may have just lost your best friend, your husband. I just lost my father in September. So I am a mentally well person. Carlin can attest. I've always been, and I do mean the word always, very happy, very bubbly, very talkative. And then I found myself being isolative, and I found myself just being sad, like out of nowhere. And sometimes those things come along with grief and bereavement, and they're extended. They go beyond 3 to 6 months. Sometimes a year later, out of nowhere, it's like, man, if only my dad were here, because there's no one who's gonna um replace that feeling, that love, that connection you had with a certain person or a certain place or a job or whatever the case is. So we in this setting of talking through different challenges and changes want to highlight what mental wellness is so that you know what being well and flourishing is, and then on the other end knowing what emotional disturbance and mental disturbance looks like, and what being in the middle is when there's something that's only happening now, but in the setting of prayer and partnership with the right people, meaning your pastor, your best friend who has your best interest at heart, and your provider, your therapist, your nutritionist, your primary care, your holistic provider, your mental health and wellness coach, whoever you're partnering with, and to get you on the other side of it. Because a lot of times we just don't know when we need help because we're so busy helping other people.
Yes, thank you, Tanisha. That's wonderful and a good point that there is no linear line for this for your mental health. It's going to come up and down and have ebbs and flows. No, I believe the next. So that's kind of what you summarize on this slide, right? About mental wellness.
Mm-hmm. Yeah, just so that people know the difference. And then, just knowing that it happens. I think that's another like undertone of this conversation is that, not the expectation a lot of times is that never are you going to feel anything outside of love and excitement and happiness and those what we call positive emotions. But anger and sadness and disappointed and frustrated, those are very real and very, they're very okay in the setting of control and directive and identifying it and expressing it in a very healthy way. There's a way to do it. So yeah. Yeah, I like this next slide that Carlin's going to present with different warning signs and symptoms because, again, to recognize and identify is utterly important.
Yes, so absolutely. So we talked about what it's like to be mentally well, what is it like to have mental illness or conditions, but some we need to also identify warning signs and symptoms. And like we keep saying, it's going to present differently to everybody. Not everybody's going to have their own or the same symptoms, but there are some common things that we can look for across all ages, adults, adolescents, across all racials and backgrounds. Um, so like if you can see excessive worrying or fear, feeling excessively sad or low, prolonged or strong feelings of irritability and anger, like Tanisha mentioned earlier, isolation, avoiding friends and social activities, inability to perceive your changes in your own feelings, a lack of insight. And then on top of all of these emotional and mental things, there also could be physical attributes that you're noticing that there's no cause. So you can have headaches, stomach aches, be nauseous, just feel sick, aches and pains. So it's going to present differently. And then of course, our stronger signs that we really want to look out for are suicidal thoughts, homicidal thoughts, any thoughts of harming, any inability to get out of bed, and not being able to take care of yourself are definitely some concerns or very concerning. So we definitely want to watch out for that for people um, in our lives and also for ourselves. And then we also have to be mindful that Black people in general are going to present differently. What burnout may look like in somebody like us is a a survival instinct for us. So we also have to be mindful of how we show up. So the next couple of slides are some statistics. 1 in 5 U.S. adults experience mental illness each year. 1 in 20 U.S. adults experience serious mental illness each year. 1 in 6 U.S. youth age 6 to 17 experience mental health disorders each year. 50% of all lifetime mental illness begins by age 14 and 75% by age 24. And the slide that we got this off of, the website we got this off of, the title of it was "You Are Not Alone." So I think that is very important to mention and make note of is that we're not alone in any of the struggles. The more we talk about it and are authentic and intentional about it, we recognize that we're all struggling at some point or have, moments of grief, as Tanisha mentioned, or sadness or anything that we can, we're all on the same page with.
And one thing I'll add to that last slide, Carlin, is that just like you mentioned, um, really strong percentage of incidents happen at by 14 is more than important for us to assess and continue assessing our young people. It's just these social constructs have introduced a lot of different things that were not there when we were 14. And so, having that awareness and that education to understand what it looks like, even in that age group, is a conversation we'll have in the future.
Yes. Hmm.
And then, yeah,
Uh,
there's statistics.
People with depression have 40% higher risk of developing cardiovascular and metabolic diseases such as diabetes than the general population. People with serious mental illness are nearly twice as likely to develop these conditions. 33.5% of U.S. adults with mental illness also experience substance use disorders as well. The rate of unemployment is higher among U.S. adults who have mental illness, 7.4% compared to those who do not at 4.6%. High school students with significant symptoms of depression are more than twice as likely to drop out. Students aged 6 to 17 with mental, emotional, or behavioral concerns are 3 times more likely to repeat a grade. So again, this is also showing that mental wellness encompasses everything. It affects everything. But we also have to be mindful of our financial health, our emotional health, our spiritual health, everything, physical health. It's all a part of it. So we have to take care of, our whole selves.
And that's what Patricia was mentioning, how they connect. Because the more stressed out you are, the more stress your body knows, whether you're saying it out loud or not. Your body understands and is processing it and um, in, affected by stress and depression and anxiety. All of those emotions and states of being, your body is definitely going to feel it, whether you acknowledge it and it stays on your subconscious. They're totally connected. So.
So this is some slides about like stigmas and trauma and barriers that how it can all affect our access to care, our mindset when we're talking about mental health. So of course, as Black Americans, we have a mistrust with the medical system, the healthcare system. We've had so many examples, Henrietta Lacks and different things going on that have, caused some concern throughout our history, going back as far as slavery and those type of things. And so these can contribute to negative encounters that we've had as well in our mistrust with the healthcare system and we may have some negative attitudes and belief towards people who live with mental health conditions. Think about the shame that some people put on the mentally ill. And it's not only prevalent within our community, but in the US, we see people in the streets or, asking for money or certain situations. So we just have to be mindful of that as well. And although beliefs and attitudes may vary, research shows that many Black adults, especially older adults, view mental health conditions as a consequence of personal weakness. And as a result, people experience shame about having mental illness and they worry that they may be discriminated against due to their condition. So these are barriers that are going to prevent people from seeking help, from seeking resources, from speaking out for, telling their story.
It's true. And actually, they do experience discrimination.
Absolutely. So this is another slide, just talking about mental health in African Americans, some more statistics. Again, factors that affect the reception of mental health services, distrust in the medical field, poverty, economic factors, access to services, a lack of understanding and education. 63% of African Americans believe that depression is a personal sign of weakness. So again, shame, um, negative connotations. 56% of African Americans believe that depression is a normal sign of aging. So again, lack of knowledge, understanding that this is not normal. It's not normal to feel these feelings. It's not normal to be sad. It's not normal to have to rely on a substance every day. So it's important that we know what is normal and what is abnormal in that regard.
I absolutely love that slide.
Uh-oh. Some more stigmas and traumas and barriers. According to Health and Human Services of Minority Health, Black adults are more likely than white adults to report persistent symptoms of emotional distress, sadness, and feeling like everything is an effort. Also, those that live in below the poverty line are twice as likely to report serious psychological distress than those with more financial stability and security. However, despite us needing more help, and there's only 1 in 3 Black adults with there's only 1 in 3 Black adults with mental illness that actually receive treatment.
Miss Christie said, why? Why is it only 1 in 3 people who are Black adults receive illness treatment? Is that your question?
Yes, yes.
Okay. Because a lot of what Carlin just said, I'll let her answer, though.
I'm trying to get the slides together. So like we said, so there's barriers, right? Where we have shame, we have um
A lot
lack
of
of lack of
what,
knowledge, a
guys?
lack of
I'm sorry.
access, a lack of
Yeah,
resources that we're going to, people that may not look like us or our therapists. There's plenty of
goodness, so
reasons why. Generational responses, you don't want to appear
expensive.
weak and mhm.
It's expensive as
Yeah,
well.
money.
Yeah. It can be expensive, I'll say. I'm sure there are programs, but all of the things Carlin said for sure.
Again, according to the American Psychiatric Association, Black Americans are also less likely to receive guideline consistent care. They are less frequently included in research, so that's going to go towards the mistrust in healthcare. We're not included in the studies that we're receiving the medications from, or the doctors are learning from. More likely to use emergency rooms or primary care rather than seek out actual specialized mental health providers. So they're not necessarily getting the appropriate care that they need. So now that we're done talking about all mental illness and mental health and illness, we're going to give you some tools to help prevent and hopefully achieve mental well-being, overall well-being, mental wellness. So these are some things more on my side on the holistic end, uh, where you can do that are free
Oh,
or affordable.
3.99. So pay close attention here.
YouTube University has a lot of great resources in the internet. But these are just things that you could do on your own. I'll go quickly. Coloring, there's coloring books. The libraries, they have adult coloring times that you can go there. Of course, Tanesha mentioned prayer, spirituality, reaching out to your pastor, your pastoral team, meditation, taking 5 minutes to do some deep breathing or exercises, yoga, slow movements, intentional movements with your body, Reiki, and energetic therapeutic modality that helps reduce anxiety and depression, journaling, writing down your feelings or experiences. Of course, exercise is important. Moving your body helps you increase your energy levels, decreases anxiety, depression, massage therapy, acupuncture, therapy, talking with somebody, a psychiatrist or a psychotherapist, saying positive affirmations in the morning. That's something I do every day before work, and it seems to be doing well. Sound healing, there's been evidence to show listening to different sounds at different sound wavelengths can help reduce anxiety and depression and improve mood. So those are things you can put into your Apple Music or Spotify. Tai Chi, grounding exercises, standing still, being mindful, being very intentional. These are things that can hopefully be a little toolkit that you can do every day that don't take a lot of time.
And I'll briefly, for time's sake, I will briefly go over treatment. So obviously in the setting of doing all of the non-pharmacological yoga, exercise, painting, journaling, number coloring, as Patricia mentioned, talk therapy, which I do, meditation, martial arts, music therapy, sound therapy, pet therapy, and also vitamins. We'll talk a little bit more about that and herbs in another conversation because those are so important. But I'll talk a little bit about pharmacological. So we've done the praying. We know the power of prayer. We know that everything in its place, talk therapy if you need to, counseling. We were taking our vitamins, we have our herbs, we're exercising regularly, but something is just not, working the way we want. So what I also do is medication management. So what that looks like, and I know for many people, not just Black people, so I won't even make that a Black thing, but many people are reserved when it comes to taking medications. I don't think anybody loves taking medications, who I know anyway. But we do a plan of care. We talk about what your expectations are, what your symptoms are, and what we can do as far as antidepressants in the setting of depression, antipsychotics in the setting of psychosis or agitation, and then mood stabilizers and benzodiazepines in the setting of panic attacks and mood imbalances like bipolar disorder. So those are just some of the things, and we'll talk way more in depth about them. And if you have any questions about anything that we've said so far, just for the sake of time, I won't go into it, but just make sure you put your email in the chat, and we'll continue to engage and let you know when things are coming up, and also offer different topic options that you're interested in that make it meaning for us to talk about it. But those are just some of the brief treatments.
In the next few slides, as we are going to start ending it, are about resources. A lot of them are free or low cost, affordable. These are also resources, some websites that offer online screenings, things that can be done without necessarily going to see a professional provider first. So these are like mental health screenings, PTSD, postpartum depression, anxiety, just overall wellness screenings. So you can take a look at the slides, but like I said, we'll send these out. So if you would like to take a look at them, you can. But these are just different organizations that you can get screenings through. This page is about resources that offer free support. So if you're going through an actual mental health crisis, you can call, text certain uh, organizations like 988 Lifeline or the National Elite, Alliance on Mental Illness. And then there's also some organizations like Therapy for Black Girls and Safe Space for Safe Black Space that can connect you with therapists or provide you with the actual community healing circles in your neighborhood. So you can take a look at that as well. And some of these organizations actually will help you find therapists or support systems based on different criteria, such as faith-based or LGBTQ. There's different criteria, military as well. Again, another page about different resources specifically for Black people, Black men, Black women's health as well. Again, another page of different foundations. These are people that are also doing advocacy and policy changes for the Black community in regards to mental health as well. And again, they have different free resources and education events as well. So now we're down to our questions portion, and we'll let Tanesha take over.
Okay, got it. So I did have four questions and I will hit them. I hope the person who asked them may have made it to the call. The first question was, what are the early signs of Alzheimer's or dementia, and what was the difference in Alzheimer's versus dementia? So Alzheimer's is actually a form of dementia, so there's not a really big differential other than its presentation. So there are a lot of signs early on, and there are lots of different subtypes of dementia. So Alzheimer's dementia is the entire name. And so that's one form of dementia. There's vascular dementia, and then there's frontotemporal dementia, and then a whole lot of other ones, some that come when in the setting of HIV only. So there's a couple of different ones. So when you say Alzheimer's, it's automatically understood